joining us for this important town hall meeting. The African American Leadership Forum, or ALF, Insight News, NorthPoint Health and Wellness, and Minnesota Community Care partnered to create a virtual town hall that considers the impacts of COVID-19 on Black Minnesota. Today's conversation focuses on the underlying issues that have made African American community members more vulnerable to the health impacts of COVID-19 pandemic and the high rates of death among Black people due to COVID-19. In addition, many African Americans don't feel safe wearing homemade masks due to racial profiling, especially Black men. Also, many Black people in the community are unable to practice social distancing or work remotely. Others feel that COVID-19 isn't a real threat to them. The panelists and today's guest will discuss the underlying causes of these feelings due to historical trauma and the steps that the community can take to address them. I'd like to welcome our guest, Dr. Julia Joseph Caprio. She's the Senior Vice President and Chief Medical Officer at UCare and a medical provider at NorthPoint Health and Wellness. Wes Berry-Belton is a case manager and advocate serving African American men at NorthPoint. James C. Burroughs II, he's the Chief Equity and Inclusion Officer at Children's Minnesota. Dr. Rahshana Price-Isuk, the Medical Director at Neighborhood Health Source, and Dieudonne Asambang, he's an MA and LADC, and I will ask him to give us the correct pronunciation of that name, and I promise to get it right from here on out. And I will also ask that I get the letters, what does MA, LADC stand for? So again, welcome everyone. Howard, I hope, and this is a loaded question, and the name of the forum is We Good. So basically, how's everyone doing today? How are you all doing?
Doing well, thank you. Good to be a part of this.
Yeah.
Really good today, Harry. Thanks for asking.
Yeah. And in today's time, it's more and more of a less of just a simple greeting, but an actual statement of how are you doing today? Are we good? A lot of times it's just very colloquial to say, hey, how are you doing? And you don't necessarily look for an answer. In today's time, we really have to look for that answer. So that's what we're going to be discussing. A lot of varying topics coming up today. So I'm just going to jump right in. And also, if you are on Facebook or if you're in the Zoom and you have questions for our panelists, in Zoom, you can go into the chat section and ask the questions. If you're on Facebook, you can ask the questions of our panelists on the Facebook comment section, and we'll transfer those over so we can try to get those answered as well. So with that being said, let's just kind of go back to some basics on COVID-19, and I'll ask Dr. Joseph Caprio, right now, how widespread is COVID-19 in Minnesota?
Well, thanks, Harry, and thanks for allowing me to participate in this. By the way, Harry was my father's name, so I love your name.
I wear it proudly. It was my father's name as well.
Oh, wonderful. Well, I was looking at the statistics just right now that were released from the Minnesota Department of Health. And from the data that they're showing, we're seeing COVID-19, the infections across the state. There's hardly a county that we don't see the infections. And of course, our most populous counties have the highest rates of the COVID-19 infection. As of today, and I'm just looking at the data, and granted this is an undercount because, as most of you know, many people who have coronavirus infection, the COVID-19 infection, or have had it did not get tested because we don't have the testing capability that we need. But so far in Minnesota, there's a reported over 2,700 cases of positive cases of COVID-19 throughout the state. And sadly, from yesterday to today, most of you probably have already heard there were an additional 19 deaths from COVID-19. And the question that I think people are wondering about is the question about the peak. When will we see the peak? Are we seeing a flattening of the peak? Is the modeling correct or not correct? And last week I was on a call with one of the major health systems that and hearing about their preparedness for COVID-19. And granted, they're preparing only really on the inpatient side to make sure they have enough beds and ventilators and personal protective equipment. And as that leader said, he doesn't have a crystal ball, and I don't think anybody really knows, except that we are most likely, if you ask me personally, only at the beginning of the impact of this on people's health in the state and on what might be the economic impact across the state. And I'll just say the reason why I'm saying that is because the cases we've had to date in terms of the deaths have been in nursing homes. And we know there are many vulnerable people in nursing homes, long-term care facilities. But sadly, and I think you might be addressing this today with this forum, Harry, is we have seen some disparities in terms of who are being impacted by COVID-19 in the state. So we're seeing infection rates, for example, with African Americans are higher than our percentage for the population, but we're not seeing what has been seen in other states, which is huge gaps in terms of those disparities. And I fear that we're only at the beginning because we haven't seen those gaps. But this also says that perhaps this is an opportunity for us to intervene so we don't see the disparities that have been seen in other states. So that's my initial thoughts on how widespread it is.
Okay. And when we're talking about the numbers in terms of ethnicity, now Hennepin County, there are about, as you said, there are about 2,700 cases in the state of Minnesota, most of them coming from Hennepin County, and then I guess the second largest is Ramsey County, and then there was the spike in Worthington at the pork processing plant there. Within Hennepin County and Ramsey County, are we able to determine how many Black people, Black Minnesotans, are being afflicted by this disease? And is there yet a count on how we're seeing in other states and other cities where the death numbers are disproportionate? Do we have those numbers here in Minnesota?
Harry, that's a good question. I've not seen, and I'm not asked the Department of Health, so they may have this information, or others on the panel may know. But so far, we're not able to tell, or there hasn't been released in Hennepin County whether there's disproportionate disparities within the county specifically. The numbers I've seen are for the state overall. In terms of deaths, we're not seeing disparities in death. We are seeing disparities in terms of infections, but not deaths, which is a good thing, which tells me, like I mentioned before, one of two things: we're early, but we also have an opportunity to intervene.
Yeah, and that's a good thing because we are in that unique position, whereas many of us, we have friends and family members in New York, in Atlanta, in Detroit, in St. Louis, all these other places where we're seeing what could be. And so hopefully we are doing what we can do to stave off the death and destruction that they're seeing. Westbury
Yes,
Belton.
you're right. Actually, excuse me for interrupting you. And we'll probably come back to that because this is an opportunity for us to require our public health officials to expand and target things like testing for the most vulnerable communities, so we don't see what has occurred in other municipalities, other states. So I agree with you. We have an opportunity now to not have what happened in other states happen in Minnesota.
Yeah. Westbury Belton. What have you heard from your clients about the impact of COVID-19? What impact has it had on them? Do we have you? I'll come back. I believe we might be having some issues with audio over there. And I'll switch over to James Burroughs. Once again, he's the Chief Equity and Inclusion Officer for Children's Minnesota. As the Equity and Inclusion Officer at Children's Minnesota, how can we address COVID-19 from an equity lens?
So thanks, Harry, for the question. Thanks, everyone, for being on board. I think it's a broad way we need to look at it through an equity lens. As the doctor said, we're not having as much of disproportionality as other cities where there is a more of a higher concentration of African Americans, as you mentioned, Detroit, my hometown, St. Louis Shores, and others. But what we are having is an impact on community. So let's play that out. So we're having a high rate of unemployment currently. A lot of companies laying off and furloughing people. My company is also included in that. We're doing some furloughs as well, some salary reductions. Typically what happens is those that are last to get into the system are the first to exit the system through that process. And what happens with us is African Americans' unemployment rate, I'll give you an example, in 2008 was 20%. Up until a couple months ago, it was like 6%. It was still twice the rate of white Americans here in Minnesota, but it was 6%. It's going to go back up tremendously. That's an equity impact that's going to happen. Another equity impact is the health disparities that existed before COVID still exist here. Health disparities in treatment, health disparities in bias, racism in the provision of healthcare that lead to structural racism, that lead to diabetes, that lead to high blood pressure, that lead to asthma. And if we don't address that, those are inequities that will continue to happen. So that's an inequity that needs to be addressed. Another is, too, how communication is given out. I'll say this lightly, but I'm hopeful that the Walz administration can include more communication with ethnic communities in a way and means they want to hear that communication for the updates going forward. What I mean by that is this. I want my brothers and sisters in North Minneapolis to be wearing masks, to be aware of testing opportunities, to be aware of how it's impacting their community. And that comes through Insight News. That comes from the spokesman. That comes from Camo J. That comes from some of our party promoters who can get on Facebook and promote some stuff around, hey, this is what you need to do. So I think that inequity there is another inequity. And I'll stop there, Harry.
And it comes from our faith leaders as well. We have so many various people who are respected within our community that aren't in the quote unquote traditional channels, and we need to be reaching out to all. It's an all hands on deck kind of approach here. And to echo your point on unemployment, I was on a call with the governor and several other reporters this past week, and they were given unemployment numbers, and the overall unemployment number in Minnesota jumped to 12%. For African Americans, that number is 26%. So more than 1 in 4 Black people in Minnesota are unemployed and being affected by this COVID-19 crisis. So I appreciate you speaking from that lens, definitely. Dr. Price-Isuk, Medical Director at Neighborhood Health Source. We know that we, being Black people, are at high risk. What are the conditions that are being considered to make us high risk for COVID-19, and why?
Hi, thank you all for having me. Well, so if you go to the CDC website, you'll see a list, right? You'll see a list of people who are at higher risk for severe disease from COVID-19. And they'll tell you, people over 65, people who live in long-term care facilities, as was already mentioned, and then people with severe lung disease, diabetes, asthma, liver disease, and kidney disease. And when we talk about disparities in infection rates, as has already been mentioned, we are dealing with high infection rates related to disparities that already exist in uncontrolled conditions. So my focus today would be talking more about the asthma, the diabetes, the chronic kidney disease, and high blood pressure. These are some of the top conditions that are disproportionately affecting minority populations, African Americans, Hispanics, and other minorities. And when we talk about risk of infection or severe disease, if you get infection, it's really related to uncontrolled disease. So I would love to encourage communities to reach out to local community clinics where they have education, where they have now telehealth visits. People to look at their blood sugars, make sure their blood sugars are controlled if they have diabetes. If you control your chronic condition, your likelihood of infection, you can decrease that. You can keep yourself safer and healthier if your chronic conditions are controlled. For example, asthma. If anyone has asthma and they are overusing something called an albuterol inhaler, that may mean they need a controller inhaler, something they take every day, no matter how good they feel. So people should really don't fear reaching out or calling your healthcare providers, your clinics, making sure you have extra medications, making sure you understand your condition. What should your blood sugar be? What should your control number, something called an A1C value? I'm putting a lot of information out there. So if you have questions about what these numbers mean, you can post the questions here, or you can reach out to your healthcare provider to really talk about that. Another thing is chronic kidney disease. The diagnosis of chronic kidney disease is really high in the African American community. And chronic kidney disease is actually a result of long-term blood pressure that's uncontrolled, long-term diabetes that's uncontrolled. So I can't stress enough just our ability to get educated and to empower ourselves about our disease and what it means and how to treat it and control it.
When you brought up several different things that I kind of want to circle back on, because it goes more to a question, a point about long-term maintenance of our bodies and how we've been very disenfranchised from the proper healthcare. When you talk about asthma, I'm a resident of North Minneapolis, and when I got here, the talk that people were telling me before was, well, for years, the air quality in North Minneapolis has been poor because you had companies such as Northern Meadows that were polluting the atmosphere and things of that nature, leading to people having a greater propensity to have diseases such as asthma and things of that nature. When we're talking about the other underlying factors, I think one thing that maybe you can address here is a retraining or re-education in terms of getting people more in tune with regular checkups. I think in the African American community, and oftentimes by necessity, we think of healthcare as when I'm acutely ill, I go to the ER. And once again, I think that's sometimes by necessity. What are your thoughts on that?
I think that is loaded, a loaded topic, only because I work in the Minneapolis community, see patients from a lot of different backgrounds, and as we all know, the institutional racism, the mistrust of the healthcare system, it requires providers that are doctors, nurse practitioners who are comfortable and have the time to discuss with their patients primary care, regular checkups versus coming in only when you're sick or when something is wrong or when you need your medications refilled. A lot of patients are fearful of going to the doctor. I often will tell my patients, I'm not here to give you a disease. I'm here to keep you healthy. They're afraid of what you might say or the information they may give you. And so we really need to help communities find providers that they can relate to, that they can communicate with, and to open those conversations and get people to understand the importance of regular care is to prevent disease or catch disease early when you can prevent the long-term complications of those conditions.
Okay. And James Burroughs, you're once again Chief Equity and Inclusion Officer over at Children's Minnesota. I'd like you to weigh in as well.
Sure. I think one of the things that can come out of this is a reinvestment in the importance of what we call at Children's well child checks and well child visits. So that's important for your child or you're in primary care to come in and not see the doctor when something's wrong or gone wrong, but we're doing the well child check ahead of time. What we have to do at Children's, and we're doing it, is we got to address institutional structural racism that has existed since the beginning of this country and before. How that impacts the willingness of somebody to come into the community. We are doing that, and we're doing that through not only training and education, but breaking down those systems that get in the way. If we're only doing well child checks during times that are convenient for our doctors, our nurses, and providers, that may not be convenient for the community. So we're doing things differently as far as the time. We're also going to have I forget what to call it, but a community wellness bus to come around and could do well child checks from a mobile clinic unit as well to break down that barrier. And we're also going to double down on this, and this is important for everybody here in healthcare. We need more Black and brown doctors, nurses, medical professionals in our clinics. We don't have enough.
Please say that again.
Yes, we need more Black and brown doctors, nurses, medical professionals, radiologists, technicians. And don't give me the excuse we can't get them to come to Minnesota. I came here 28 years ago. I'm still here. Harry, you came a while ago. We can come and stay. But we have to be intentional. We have to partner with maybe Morehouse School of Medicine, Meharry, Xavier University on undergrad level, because that will show people and show not only adults and children that we really care about addressing this cultural ignorance that we've had for many years, and we want to address it from a wellness standpoint. And the other thing too is, I'll say this here and I'll wrap that up there, we got to continue to invest in community organizations. Don't get me wrong, finances are real tight now at all these organizations, including Children's, and we're pulling back on some things that we had planned for the year. What we can't pull back on is that community partnership is going to bring us a relationship with the Latino, Native American, African American community, and say that, we don't have the money to do it. Now's the time to double down on it, to end these health disparities, so we don't have to worry about this going forward. So I'd say that's very important, and Children's, we're committed to doing that.
Yeah. So, and that's very important when you're talking about it from a pediatric level, because as we all know, habits are learned. And so if you are used to getting a regular maintenance checkup, so to speak, on your body as a child, you will continue to understand and grow to say, hey, this is something that I'm supposed to do to keep myself well, as opposed to making it a critical care decision. And then also on to your point about having more Black and brown faces in the medical community, one of the things that has been exposed through all of this crisis is the inherent racism and possibly unintentional racism within the medical community, where it's been said that Black people will go and they will exhibit their symptoms and people will say, oh, it's not that bad, or you don't know what you're talking about. I'm the medical professional, you're not. And so, but oftentimes when we're talking with one another, we take it more seriously, meaning the people in the medical profession. West Berry-Belton, do we have you back? Okay, I don't think we have him back. Right now, when we're talking about the current crisis that we're in, it's very much about prevention. And we've been doing a really good job, and we want to keep doing a good job. I'd like the doctors to speak on the importance of wearing masks. And then on the back end of that, we'll talk about the social implications of mask wearing.
Sure. Would you like me to go first, Terry?
Sure.
Okay. Yes, but if I could, I just wanted to speak a little bit to why the African American community is more at risk for COVID-19 overall. And what we know, and it goes to what Mr. Burroughs was just saying, there are disparities in terms of people, diversity in leadership in healthcare organizations, disparities in terms of physicians and nurses in healthcare organizations. However, when you look at folks who are oftentimes the frontline staff, the medical assistants, the nursing assistants, the PCAs, those people who are on the front lines of caring for the most ill, including the most ill with COVID-19, are oftentimes from our communities of color. So that's why that group is particularly at risk for caring for and then getting a COVID-19 infection. I just wanted to say that because I think it's important to recognize and thank those people. With respect to masks, I believe that initially I was thinking, well, you know, unless it's an N95 mask, which blocks 95% of the particles, or it's a surgical mask, then, you know, those fabric masks would serve no role. I think I'm now come around to believing if all you have is a fabric mask, then that might have some benefit in terms of preventing some of the coronavirus particles from entering your nose or your mouth. But I think it's important for people who are directly caring for others that they have the proper protective equipment, so the proper masks. So I would just say for folks who are out and about going to the grocery store, if all you have is a fabric mask, then I think that's fine. I'd be interested to see what others think.
Let me see here. So, and I apologize again, Dieudonne Asambang. Are you with us?
Yes, he might be muted.
I'm here.
Oh, okay. Hey, good afternoon, brother. How are you doing?
Good.
Good. We're going to get to talking about the wearing of a mask, and well, we've been talking about it from a clinical standpoint, but I'd like you to speak on it from a societal standpoint. And I'm just going to kind of demonstrate here because, once again, you can't find most of your surgical masks and things of that nature. So people are coming up with homemade solutions. Mm-hmm. I don't have any bandanas, but I used to. Just don't happen to have any of them around. So when I'm out and about as a Black man, walking, going to the grocery store, one, I don't have on my glasses. I normally don't have on a suit and tie, but I do have on this.
Yep.
Now it keeps me protected from, or possibly keeps me from infecting someone else if I'm infected with COVID-19. But it doesn't keep me protected as a Black man from being considered a suspect. Mm-hmm. And I have to think about that every time I wear this ski mask when I'm out. And I know that I'm not the only person who has those thoughts in the back of my mind. Mm-hmm. Eric Roberson, one of my favorite artists, he has a song. He says, the Black man's got to think about everything. Mm-hmm. Every decision that we make, we have to think about it before we even make it. So would you talk to it from a societal standpoint in terms of the anxieties that we're having?
Yes. So talking about that, there's something out here called the COVID-19 anxiety. And it's just about talking about how to deal with your fear and stress and things like that. Just to go back a little bit about the mask you were just talking about, what I've encouraged people of color to do is to not wear anything Black and maybe find ways to get masks that are colorful. That way you cannot be mistaken for somebody else. You know, but there's a lot of anxiety that has surrounded this COVID-19, and the reason is because we are very, very uncertain about what is going on and how to handle all those things, and it leads to us catastrophizing and getting so overwhelmed with everything that is going on. So sometimes I do see quite a bit of clients that are suffering from anxiety, and normally some of them had just a normal anxiety, something from a day to day, something that is expected. But recently I've seen a lot of clients with problematic anxiety, which is so chronic and irrational, and that has affected a lot of the life functioning. So I kind of come from a point of how do we deal with that anxiety and fear when it concerns COVID-19 anxiety. So we work from CBTs, from a cognitive behavioral standpoint, and sometimes from a motivational interviewing standpoint as well. And we try to come up with some strategies and skills to deal with those anxieties surrounding the COVID-19. And a few points that we work on sometimes is just to stay informed. In addition to putting on your mask, in addition to having the hand sanitizer and using some other things out there, just stay being informed, because there's a lot of misinformation out there on the media from different people that just goes a long way to feed into that fear. So being informed is more about just getting the information from a trustworthy source, just adhering to the CDC guidelines and things like that. And also focus on the things that you can control. That is taking steps to reduce your own personal risks. Things that I cannot control, I cannot focus on things like that. Things I can control, like washing my hands, those are things I'm gonna do. Avoiding touching my face, avoiding the crowded crowds and things like that. Those are things I can control. So focusing on that. And then also plan for what you can. So what if this period goes beyond 3 months? What if it goes beyond 5 months? We just come up with some, or try to come up with some proactive strategies to help control our anxiety. Writing down, coming up with a SMART goal for that period. Like if it goes beyond 5 months, what can I do within that time? If it goes beyond 6 months, what can I do within that time? And also staying connected with our family, even though we are in isolation, in loneliness. And being in isolation and loneliness can exacerbate that anxiety and depression. So it's just more about talking to the positive people in our lives, not focusing on what is going on, but focusing on the solution. I know the problem is the COVID-19, but talking more about the COVID-19 is going to lead more to more anxiety and more fear and more stress. So let's focus on things that on how we can deal with that. And then the biggest piece here is taking care of ourselves and our spirit, but just practicing self-care. Find time to do some activities that we do enjoy. It can be a board game, it can be playing cards, it can be doing stuff, anything that we enjoy. It can be something that's going to go a long way to elevate our anxiety. And then what I see during this period is a lot of self-medicating. People medicate with alcohol and drugs because the anxiety is at the point where they cannot manage. So they go into self-medication. Some of them are even scared to go see a doctor because of thinking that they might pick up something from the clinic if they go see a doctor. So there's a lot of self-medication, and that just within this period of the COVID-19, I have like expanded my scope because I work primarily with addiction, but I've expanded my scope to also see clients with mental health. And so those two things, they kind of go together. So I do have some clients or people that are struggling with this anxiety, and they tend to drink more, use more drugs and things like that. So just coming up with these strategies to deal with that anxiety works magic. And the biggest piece too is kind of like just finding some time to relax, meditate, do yoga and stuff like that. That helps a lot with the clients I'm seeing right now.
When you first began speaking about the mask, and this isn't hyperbole or me exaggerating now, I was literally holding back, trying not to tear up, because you said you had to suggest wearing colorful masks to not be perceived as a threat. And it's stunning, and just still just infuriating to know that in the midst of a pandemic, we have to still try to appease others with our appearance, rather than think of our combined safety first. You mentioned something about being informed versus being informed, and my question is, how do we strike that balance between being informed and overindulging? Because I think I find myself in this situation where I'm trying to make sure that I'm informed about everything going on with COVID-19, and yet at the same time, it's heightening my anxiety because I'm so informed.
Yes, it's just I get that point. The thing here is being informed is just trying to get the information from the right sources. Contacting, like I gave that example of looking at the CDC website or talking to a professional that knows a lot about that information, because there's a lot of things out here on the news. And that example, I'll give you a typical example here. When this COVID-19 pandemic just broke out, a lot of people were saying that things like regular sex kills a COVID-19, or COVID-19 is not a Black people, brown people pandemic, and things like that. So being informed is just making sure that you're getting those things from the right sources. And I tell you, if you watch the news every day, there are a lot of misinformation out there that is just gonna spiral that anxiety. So let's stick to the right sources, talk to the right people.
Mm-hmm.
Am I able to speak to masks a little bit?
Please.
Okay. This is Rahshana, Price-Isuk again, medical director. I'm a family physician at Neighborhood Health Source Community Clinics in North and Northeast Minneapolis. So I totally resonate with those sentiments of we should absolutely not have people worry that they are going to be pegged or judged or picked out because of this mask issue. And I honestly believe the opposite is starting to happen. I saw in the chat group someone talked about they wear a mask in public because they have allergies and they don't want someone looking at them crazy when they sneeze or cough. And I honestly think we're going in the opposite direction, where if you sneeze one time and you don't have a mask, someone's going to be looking at you crazy, like, where is your mask? I think for the Black male and the mask issue in general, no one needs to constantly walk around with a mask. To Dr. DiCaprio's point, we don't know that regular homemade masks or bandanas, we know that they're not effective if you're dealing with someone at home who is a known positive, or if you're a caregiver. But what you maybe should do is have that homemade mask or your bandana for, like, if you are in that grocery store or you can't be 6 feet away from someone. That's what I do, because honestly, masks are hard to wear anyway. I don't care what kind of mask, you don't want to have it on 24/7. And so just using it during those times where you need it, where you're in a social setting, or like you said, if you're at work and you can't social distance. I think one issue I saw in the media was actually minorities who, these plants that are closing down. And minorities and other workers are not being cared for by their employers. Like, they're not given the proper equipment and masks. And so that's another issue we have, where minorities are disproportionately affected because they don't have proper equipment. So again, I know that was a lot of information, but I think the main points are we should be counseling our patients on what masks really can and cannot do, how to keep themselves safe. And another comment on the chat group, you all, I can't figure out how to send replies to the chat group, but anyway, another.
And we'd ask that you reply to the general public anyway, because some people don't get the chats, and there are people on Facebook.
Sounds good. Yeah, another comment on, now I lost my train of thought, but another comment on the chat group had to do with, we need providers, physicians, nurse practitioners who are trained in trauma-informed care. So back to the issue of, you know, Black males have suffered a lot of trauma. And if we can come at people understanding that their fear of wearing a mask is real, then we can better counsel them on how to take care of themselves in the community. If we can come from a standpoint where we understand a young African-American female or any other female who suffered sexual assault or rape, may be fearful of a pap smear, that we can work with communities and patients better to help them take care of themselves. So I know trauma-informed care is something that our clinics are going to start getting trained on. So this way, you know, until we build our workforce with, like you said, more Black and brown providers, we can train all races and ethnicities on how to approach people from a standpoint that everyone suffered some level of trauma in their life, and that level of trauma forms our perception of wellness and how we keep ourselves well. So those are, I'll stop there.
And Harry, if I could add one thing about masks.
Yes.
And I'm glad that the counselor is on the call, on the forum. I heard from someone who wants to wear a mask, but to what the doctor was saying, has a history of anxiety and feeling claustrophobic. And so she said, it's really hard for me to wear a mask. So I'm happy that there are others who are working with folks who have to deal with that so they can help them feel comfortable wearing a mask. But people come from, you know, histories of trauma and, you know, long histories of racism that the CDC or others may say wear a mask, but it may not be that simple for people. So I always want to make sure that we understand where people are coming from, because there shouldn't be any stigma attached to folks who are out and about, maybe not masking. Maybe they're just not able to yet. They're trying to work towards wearing a mask. So I appreciate what someone said about having allergies, because I think the person on the chat was saying they want to, you know, they wear it so that people don't think they're sneezing because they have COVID-19 and infecting folks. So I think we have to work to be generous towards others. That's what I try to do when I see folks not wearing a mask, because they may not be able to yet or feel uncomfortable.
Mm-hmm. Yeah, and James Burroughs, you're part of many different networks. You basically the connector, as I like to call you here in Minnesota. Have you had any discussions with any of the organizations with whom you're involved in terms of possibly having a, whether it's an awareness drive or a session to either create masks for people who don't have masks and things of that nature?
Thanks, Harry. One of the things that Stella Whitney West, who's at CEO of NorthPoint, and I talked about last week was, how do we talk to our community about masks and the opportunity to wear them if we do have cloth masks? So one of the things we suggested was, how about we create, and I came up with this, my fraternity does a masquerade party every year, but we canceled it because of this. How about we turn that into a mask, M-A-S-K, party, and then we go make some cloth masks as a community together. We have some fun patterns we put together. We learn how to make a mask. There's tons of sewing machines in different companies that are shut down right now, and we come together within, you know, within our socially or physically distant distances to make sure we're safe and wearing proper care. but do that. And then also get into the community and say, hey, this is the importance of wearing a mask. This is the important, and it's not going to protect you from COVID. Let's be clear. The mask, the non N95 mask can possibly protect droplets from you on someone else. But that's still a protection for the community, because a lot of times we're not able to social distance in our community because we may have 5, 6, 7, 8 people in the house. So that social distance piece may not be real. But in addition to wearing the mask, Harriet, I think the coming together, making masks and distributing in the community is one thing we can do. The other is, the bigger issue too, is convincing our community that this is something that's happening to us. I'll be honest with you, for a month ago, people were like, well, no, Black people can't get this. No, it's not something we can get. That's what I was hearing in the community. Now that we've gotten it disproportionately, I don't know about you, but even if they do free up some of the restrictions and we can go hoop tomorrow, I'm not going to play basketball tomorrow. I'm not going to get anything in close relationship. Even with the golf courses open, my sticks will stay in my garage right now because I am African American. I do have high blood pressure, so I have a morbidity that could lead to catching COVID. I think more importantly, in addition to the mask, we need to talk about that as well. I think that's where we can all come together, Harry, as community leaders, party promoters, organizations that are on this phone or on this call, politicians, and let's make some masks together and distribute them. So I think that's the important piece, that people take it seriously, because some people aren't, because they haven't had the opportunity to be informed. They haven't had the opportunity to someone to tell them the importance. And when I see people together that are still having events, not a lot, but still having events, and they're not physically distancing, we got to speak up. We got to speak up and say, hey, you may not have done that in the past, but this is why it's important, and this is what the medical evidence is telling us.
Yeah, we unfortunately, our community lost a young brother this past weekend, and from my understanding, it occurred during a party type gathering. And in my hometown of St. Louis, just this past weekend, we had 6 deaths due to gun violence and 7 injuries due to gun violence, which speaks to a broader conversation that needs to be had within our community, for sure. But it also speaks to the fact that many of our younger community members are not adhering to social distancing, not gathering, things of that nature. So I just kind of open it up at this point and talk about how we can get the word out to our community that this is real, this is happening. And I guess at this point, let's start talking about fact versus fiction, and open it up in that forum, because if you're on social media, you see, well, our community can't get it, or COVID-19 is caused by 5G, or all these other things. If you have a hair dryer, you can kill the virus. All these other statements that are out there and being propagated. So I guess I'd ask, in particular, the doctors to speak on some of the facts of COVID-19, how you get it, how you are able to stay safe, and then let's debunk maybe some of these myths as well.
Sure. Yes, I would really love to speak on a comment James made and speak to the younger, healthier community, and then I'll let maybe Dr. DiCaprio talk about symptoms and how you get it, and et cetera. I think the key thing James talked about with the mask is, he said masks are protecting maybe my own droplets from getting on someone else, so you're protecting the community. And I think for the young, healthy person, they are not, and especially if they don't live with a grandparent or a parent, they are not thinking about the realness of this. And what we do know is that 13% of small children, so kids are asymptomatic carriers. And then there's another subset of like the young, healthy, the 20-year-olds. We don't know. Now there are other symptoms coming out, like you may not have a fever. You may think it's your allergies or a sinus infection. And again, this is getting into the broader issue of being able to test communities. But until we are able to do broad testing, we have to do what's in our power to control disease, which is taking it seriously, social distancing, depriving yourself of that urge to, have a party up front, because it's protecting those with the diabetes. It's protecting your aunts, your uncles, your grandparents, because even if a healthy or that 26-year-old that does have asthma, so you're at that party and you don't know which of those young, healthy people have an underlying medical condition that's going to affect them. So we need to work hard to, if we get a cough or cold, we may not be able to go see the doctor, but we need to just take care of ourselves, because we do know there's no treatment for viruses. There's almost no treatment for even influenza, right? It's symptomatic care. It's staying hydrated. It's taking care of your diet. It's taking medications to keep your fever down. So if you get sick, call your doctor, stay at home. And if you're healthy, social distance, because you don't know if you could be an asymptomatic carrier. You don't know if you've been exposed yet. So until we can do testing for everyone and get testing in communities, that's what we need to do. And we need to get that word out to our healthy young people and try to get them to take note of that. And then one more comment that I think is an important conversation that was on the chat is, with clinics denying people medical appointments, how can you advocate to be seen? And I know Dr. DiCaprio responded, and this is important, that more and more clinics are having telehealth visits. You can always call your clinic to get advice or get a telehealth visit and decide what to do. At this point, we just do not have the ability to test everyone who needs to be tested. And then I'll let Dr. DiCaprio go from there.
Oh, thank you. I actually don't have much to add, because you talked about the asymptomatic spread of COVID-19, which I think is important. The way I think about people saying 5G causes COVID, or a hairdryer will cure it or protect you from it, is I think, and I'll be curious to what the counselor thinks, it's a way for us to make sense of something that's hard for us to grasp. I mean, if you go back to the beginning of the year, all of us, entering 2020, I mean, we all had grand plans of, the new decade and all the things we were going to do. And here we find ourselves not too far in the year with everything seemingly have been turned upside down. So I think people, when they grasp onto things like 5G or a hairdryer, are trying to make sense of it. So I think the role of leaders is to help folks find other ways they can make sense of it and have control. So how do you have control in this situation that seems to be out of our control? Well, you can control where you go and how you stay away from folks and how you keep other people from getting sick. I've seen many young people, maybe a little bit to the counter to what you were saying, Harry. I've seen many young people who were ahead of staying away from folks, not because they felt they were going to get ill, because they worried that they were going to get others ill. In fact, my daughter was the one who told me, why are you still going to the Y to exercise? There's all these old people there. I know I'm old. I know I'm one of the old people, but I'm not as old as some of the other people at the Y. And she was like, you're going to get them sick. And then I thought, you're right. Why am I going to the Y to exercise? I'm exposing other people. So I think there are many young people who are ahead of the rest of us. And I think we have to turn to them and really ask them, and really empower them. But I'd be curious to what others think about how they or others are trying to make sense of what doesn't seem to make sense now.
Brother Asambang, would you like to weigh in? Do we have? I think we might have lost the connection there, but so we'll try to get that back. But I do concur with your kind of assessment that trying to make sense out of something that doesn't make sense. And I guess maybe another thing is we're getting so many different messages from so many different angles. Once again, from the top down at a federal level, we were told that this won't affect the U.S. Oh, it'll be over before you know it. And then now you look at it, and we're the world leader in cases and deaths. And then we find that a subset within that world leader is that Black people in America are leading the way when it comes to death and the effect of this disease. And so, yeah, we are all searching for answers. And I know, speaking to the anxiety, none of us are immune. I will openly say that I suffer the anxiety. I also will say I've been psychosomatic for, I don't know, 3-4 weeks now. Every time you cough, you think, uh-oh, that's it. Or there's a nonstop ringing in my ear, and you think, well, that's got to be related to something. And what I realize is related to is I'm not sleeping. And so therefore, it's causing other issues. And I think a lot of us are having that disturbed sleep pattern because of the stress of this disease, the economic stress that many of us are seeing because we've either been furloughed, laid off, or assume we might be the next ones to be furloughed or laid off. And so I think that's a lot of what's happening here. And it is because, once again, we don't have a clear linear information pattern with this disease.
Can I just piggyback on what you were saying, Harry? You know, I really resonate with that. You know, in an ideal situation, with this type of catastrophe, you would look for your highest level of government to take the lead in providing information, true information, and a path forward. Well, that's obviously not occurring out of the federal government. So I think I like this forum because even though the state is doing a much better job than the federal government is doing, I think we all have to think about what is our role without this leadership. There's no leadership in terms of central leadership in the country, which is what is required to deal with this. So I can understand why folks are struggling because what would normally help, we don't have here in this country.
And this is James. To that point, we don't have it, but I'll be just candid and transparent. For a long time, Black people haven't had it. A long time. So we don't have it. We don't have to turn on that press conference or that campaign speech every afternoon at 6. But what we can do is a couple things. One is from a state level, we have what's called the POSSE, the People of Color and Indigenous People Legislative Body, where it's Asian Americans, Black Americans, Africans, Indigenous people who are fighting for us at the state legislature for dollars and resources to invest in health disparities. So if we invest more money at the state level now to say, you know what, COVID has impacted these communities because of these morbidity conditions, let's look at well-controlled asthma. Let's look at combo vaccines. Let's look at preventing diabetes. Let's look at other things that are impacting those communities and invest in them at the state level. Invest more money in public health. Invest more money in programs that are going to lead to employment and housing for people of color who are suffering from these things. So I think with Governor Walz having a much better direct communication with his state than we have at the national level, there still needs to be action with respect to resources and invested. And there needs to be action with respect to what are the next strategies to, as you said earlier, Harry, prevent these things or creating a pattern of behavior that's going to have the next generation not have these conditions. And also changing our hospital systems, the structural racism, institutional racism, and the lack of trauma-informed care that we have. So I think a resource grab with all these big corporations now is like, hey, we got to get money to keep going. I got you. That's important. But we also have to invest in these communities as well.
Yeah, absolutely. Circling back, so we understand that, and it's kind of what you were saying. We're relying on a system that has disenfranchised us already to help protect us, and therefore, Black people have a kind of earned distrust of government, so to speak. Within my lifetime, I was born in 1970. The Tuskegee experiment didn't end until 1972. And so then also you had the government that was spraying chemicals on Black people who lived in the projects in St. Louis City to see how the chemical reacted to them. And so we keep finding out these things, these very distrustful acts that the government has perpetrated on Black and brown people. So now we're asking Black people to have a certain level of trust. How do we get people who are distrustful of the government in general to say, no, we truly are working within your best interest, and get them to, even if they don't trust the government, get them to trust science?
Gary, can you direct the question to one of the panelists?
Yeah, I'm sorry. Yeah. One of the doctors, if Dr. Price, or would you like to? Do we have you there? I think you're muted.
I am here. Can you just repeat the gist of the question? I was having a couple issues here.
No problem. So basically, Black people do have a healthy distrust of the government based upon the history that we have with this country. With that being said, with this pandemic affecting us greatly, how do we get more trust and get people, even if you don't trust the government, to trust the science?
Yeah, that's a tough question, and I'm coming at it through my own personal lens as a family physician, which is trying to educate one person at a time. I think everything is really relational with people. So if we can get trusting relationships and communities with organizations, like NorthPoint, like Neighborhood Health Source, like Minnesota Community Care, all the community clinics or other organizations, if we can get correct information in the hands of community members who have the right information, that's the way to communicate it to communities. For me, being a physician, I think I often tell my staff, we take for granted how much people actually do know and about their bodies, about themselves, and how much people can understand. I don't care what their educational level. You can explain things in a way that people understand science. And if they trust you as an individual or the local organizations, we can, make communications, one-page informational sheets, flyers, or different things that have information important to individuals. And I think that may be how it needs to happen.
Mm-hmm.
If that makes sense.
Yeah. And Dr. Joseph DiCaprio, along that same vein, for instance, once again, we were talking about the lack of a clear message from the top down. And for instance, the president goes on TV and he touts this possible quote unquote cure, which is a drug that's been out for years they use to treat malaria and lupus. And yet they want to test this drug in Detroit with, again, the most vulnerable population.
Right. The drug that has been shown to have huge side effects when used for COVID-19. Yes, and I agree with you, it's inappropriate, okay? But the one thing I think about to be quite honest, what the president says, is if you were to take what the president says, and you said, okay, well, suppose, here you could either live by doing what the president says or by what the New York Times says or the Washington Post or the Star Tribune. Who would you believe? You have one choice. You can't do both what the president says and what these other people say. Who would you believe? But unfortunately, people, even if they think, oh, I don't really believe him, they kind of believe him. So they're thinking, well, maybe there is a cure. Maybe I do need to go get a prescription for chloroquine or hydroxychloroquine, which were the two drugs that the president was touting. So what happens is you start to see inappropriate prescribing. So just to let folks know, and others on the call probably have seen this, we as a health plan had to start to monitor because people who have lupus or malaria, we were worried that as the other folks were starting to hoard those cures, that other folks wouldn't get it. So yes, it's very dangerous. It's dangerous if you want to test it in a community when all the normal testing around drugs hasn't occurred. And it's dangerous if you tout it as a cure and people go out and try to hoard it.
Yeah, and I just feel that in many ways we are being used as guinea pigs in this dangerous experiment because once again we're at such a vulnerable level where, quite honestly, if a person is in that situation, they might say, "Oh yeah, give me anything. I'll try whatever."
Mm-hmm.
Right, and
Well,
you can see on the comments, oh, excuse me.
No, go ahead.
The comments, there's a number of comments about trust, and I think Dr. Price referenced this, and developing relationships. And it's only with time, not in the course of a pandemic, but over time and with organizations like, Neighborhood Health Source, NorthPoint, the community clinics, that trust is built with folks so they can say, I don't really know where to get information from when looking at the media or what's on TV. But they could say, but I trust and know my provider, and I trust and know my clinic. Let me turn to them first.
And can I comment about, the community trusting science? Again, piggybacking off what Dr. DiCaprio said, when you talk about when patients often come to me and I want to change their medication regimen or different things, they'll say, well, I don't want to be used as a guinea pig. And I'm able to look at that medication and say, no, actually not, because this drug has been around for X number of years. It's very safe. And it's just a matter of finding the right medication that works for you. With this situation that our government has created, it is totally reversing being able to get our communities to trust the process of research, which another area where we are disproportionately represented, which is why sometimes we can't say this medication or that medication is best in this community or for this type of person, because minorities are underrepresented in research. And if there does become an ethical study, how are we going to get communities to be involved in that? Because right now it is, sorry to say, a total mess. And so hopefully we can find ways, like you said, to intervene and to not go backwards with building trust between the science community and, our communities.
It's interesting because we frame trust in such a way that it's burdened on the community to trust these institutions. We've not asked these institutions to be more trustworthy. We have a heavy lift in a neo-colonial country that's still colonized by Western superpower to lean in terms of the healthcare system to be more trustworthy, whether it be producing more information that's relevant to the community, the Black community, that tells the truth, that demonstrates cultural humility, that it's aligning its resources as a healthcare system, its resources to community efforts to improve the health outcomes, to truly move the dial on health outcomes in the community. That's transformative in terms of social determinants of health. The healthcare doesn't just happen in the clinic, it happens in the availability of healthy food resources in our community, clean water, mental health resources. It happens in stable housing. That healthcare is a broader public health concept, and we need to see our government partners be more trustworthy in addressing the broader conditions that impact health, impact the health of Black Americans, and that will help us be much more trustworthy I'm gonna help them be much more trustworthy and allow us to be more trusting of our allies in the larger government and healthcare system.
Okay, and that was a new voice. And so would you like to introduce yourself, please?
This is Ruben Moore. I'm the Chief Executive Officer of Minnesota Community Care.
Thank you so much, and thank you for that insight. I'm going to try to look over here and into the chat and address some of the questions that we have over here in the chat. So someone asked if any of the clinical leaders on the call want to touch on the recent national discussion about antibody testing.
I responded a little bit to that in the chat. Would you like me to go, Harry, or have
Yeah,
Dr.
please.
Price go? Okay. Yes, I think, I don't know how others are thinking about this, but my thinking about the antibody testing is that it's absolutely required as we try to understand, first of all, what's going on in terms of the spread of COVID-19 and who is working safely or not working safely with our most vulnerable. So to my mind, we would want to know if someone is on the front lines taking care of people who have COVID-19, how at risk are they? Are they protected enough? The challenge that we're seeing is that people are using this as an opportunity to, enter the market with unregulated antibody testing. So the quality of the antibody tests are uncertain. And of course, without a central or any sort of true monitoring and of these antibody tests, they're being widely distributed and of course not available to a lot of people, even though they're widely distributed. So you have these low quality or uncertain quality of antibody testing that are usually being used to make decisions about whether someone can safely work or not safely work. And of course, it's interesting, I think, that I think it'd be important to make sure that as high quality antibody tests are available, that they are being distributed to the most vulnerable, where the most vulnerable people live. So that was what I was referring to when I talked about having a better understanding of what's going on in communities. Harry, you asked about disparities in Hennepin County. And I think it'll be important to know and to look and learn from the experience outside of Minnesota, which are the most vulnerable communities, and to make sure that high quality testing, whether it's for COVID-19 or antibody tests, are targeted to those areas so that we can perhaps not become like other states.
Another question, and I'll just read it. It says that, are you all aware of what's been happening in Worthington, Minnesota, which we touched on very briefly. And it says, is it possible to help conducting messaging regarding ways to properly take care of their loved ones who have been diagnosed with COVID? So I'm gonna, basically, I guess it's a two-part question. So, and I'll go to the back end first. You have a loved one who's been diagnosed with COVID. What should you do?
Dr. Price, did you want to go first?
Sure, since you went first last time, but I would be happy to have you go first, but I'll take a stab at it. I think it's probably variable and complicated. If you're a primary caregiver, hopefully you can acquire some type of mask or equipment, wearing gloves, that type of thing, if you're caring for the person. If the question is, have you already been exposed, you would quarantine, with that loved one and take care of them. And then also there's the issue of underlying health conditions. If there's underlying health conditions that are going to put them at risk for severe disease, definitely be calling your local, clinic to see what you can do to get, oxygen saturation levels, temps, some type of assessment to see if you need to go to the hospital. I'm not as privy to the details of what's going on in southern Minnesota. So to answer that question, someone might have to recap the situation. And I'll let Dr. DiCaprio speak on that also.
And just to recap the situation of what's going on in Worthington, there's a pork producing plant that has a high outbreak to the point where they had to shut the plant down of COVID-19. And Worthington is in the southern western corner of Minnesota, right near kind of the Iowa border. And so they've had that kind of unusual spike that's in a rural area.
And when I think about what's happening in Worthington, but also what's happened across the country when looking at which communities are being disproportionately hit, the elderly in nursing homes, many of which are provide substandard care just because the people work there aren't being paid appropriately. But what we're also seeing in terms of disparities with, African Americans or Latino communities, I think of that as this pandemic is making all of our warts visible, or more visible. As James said, they were always there, but this, I think, really exacerbates them. What I did, just to the question about what to do if you have a loved one who's been diagnosed with COVID-19, it's really hard because, when you think about what they did in Wuhan, China to get control of this pandemic, everyone who's read those stories says, boy, that's not happening here. Because what they did was if someone was suspected of having COVID-19, they were immediately tested and they were removed from the home and cared for separately, because it's impossible to care for folks in your home with COVID-19 and keep yourself from getting it. And then maybe you're asymptomatic, so you have COVID-19, but you need to go to the grocery store because there's no one who can do that for you. So then perhaps you go and spread it there, and no one has the best masks or best protective equipment to protect themselves in their home if they're caring for someone who has COVID-19, and then leave and make sure they don't spread it to other people. So I don't know, as Dr. Price said, this is a mess.
It is, and that's a tough question to answer, and there's layers to that question. So I would definitely say if there's someone with a loved one with COVID-19, that a healthy person should be reaching out to get advice tailored to that particular person, because it may depend on if they have asthma, diabetes, or any other related condition.
And telehealth is one of the ways that people will be reaching out to their medical providers. James Burroughs, when we're talking about telehealth, there's also an equity lens there as well.
There is. I think one of the things we sometimes not forget, we got to remind ourselves, we had a broken system before COVID. We had a broken system that was delivering health disparities based upon race. So just because you add telehealth in it doesn't mean you're not going to have disparities based upon that telehealth connection. So if you have your connection with your doctor by video, or you're making sure that they check in with you that way, who has access to that? Who has access to the internet, access to computers, access to telehealth means for patient care? Similar to education, I know it's not talking about that today, but we're distance learning all of our kids now. Well, if our kids of color were having educational disparities while they were in the classroom in front of the teacher every day for 8 hours a day, now you got me teaching my child through some kind of distance learning thing that's not racially balanced or equity balanced, you're going to get the results you expect to get. So I think it's important for us to demand, not ask, that telehealth have an equity lens, education and distance learning have an equity lens, and those things are important. I want to shout out to Irma, who's with Latino League. She posted some information on meat packaging plants and the new guidelines they have around that. And one thing I want to say too is it's important at this time that our Asian, Latino, African American leaders work collaboratively together. Because if we don't, this is what could happen. You know what? Them people from China, they brought in that virus, and it's the Asians' fault. you know what, all them Black people getting impacted, I don't want them to come into my business because 70% of them are being infected by COVID. Well, you know what, those Latino folks that are down in Worthington, the meat packing folks, I don't want to hire any immigrants anymore. And we have the possibility of falling into fighting each other and making our own narratives and stories negative, rather than say, you know what, we're going to collectively all come together and address this accordingly. So I wanted to definitely just shout that out. I know Alf has done a good job of working across those lines or collectively together, but that's important to say, because I've heard too many people say that in the community, and I've had to correct them to say that we're all being impacted negatively. Let's see how we can work together.
Absolutely. And I've unfortunately encountered that same type of racism just being at the grocery store, where a white man made a derogatory comment toward our Asian brothers and sisters. And he found out quickly that I wasn't the one to partake. And we have to be there for one another, certainly in this time, and in all times, but certainly in this time. We can't be divided among these small lines. A question, Dr. Price-Isuk, there's a question from the chat, and it says basically, what are some of the exercises or things that the community can participate in order to remain healthy during this crisis?
So the question is speaking to physical activity, I'm assuming. Okay. To my current knowledge, you can do any level of activity as long as you're social distancing or you're alone. And I am trying to encourage people from our communities that I'm seeing as patients to get out, because now with the stay-at-home order, there's also this fear, this misconception that we can't go outside at all. And we're not staying up to date on the latest information, which is that you can go outside, you can exercise. If the weather's permitting, go out and walk, get exposure to sun when the sun is out, because that will also help our mood, as well as help, keep our weight down and just maintain the activity of our limbs when you're talking about knee stiffness and all those various things.
Does that hyperexposure to the sun, the hyperexposure to vitamin D, also help in your immune system?
Absolutely. Vitamin D is, your body makes it from the sun, and it's helpful for your immune system, your overall well-being, skin, bones, everything.
And people of color, we certainly suffer from sometimes a lack of vitamin D because, correct me if I'm wrong, do we not absorb the same levels as others, and so therefore we should be supplementing?
Every person of color, and then especially people in Minnesota that live in Minnesota, actually have potentially vitamin D deficiency, because we quarantine every year when the weather hits below zero. We're indoors, and that increases our risk of vitamin D deficiency. You can do a daily supplement, but if you have known deficiency, you might be on prescription doses for several weeks. And I think our exposure and absorption is the same, as long as you have to have periods of time where you're not using sunscreen as well. So, we're not getting into that today, but another misconception is that people of color don't need sunscreen and that they don't get skin cancer, which, whether you're darker skinned or lighter skinned, we all need sunscreen. But for the purposes of vitamin D, you should get at least 15 minutes a day of sunlight, sun exposure without sunscreen applied, so that it can absorb appropriately.
James Burroughs, I'll direct this question to you because you formerly worked in government as the Chief Equity and Inclusion Officer for Governor Dayton. It says, what can we do to hold our elected officials and health officials to move from acknowledging the root cause of the disparities in people of color communities to prescribing the fix?
That's a good question. I'd say first start with Minnesota Department of Health has a health equity unit run by Bruce Tao, T-H-A-O. And Bruce wants to hear from community members about what they could do differently at the Department of Health. Commissioner Malcolm has done a good job of working to address some of the issues related to COVID, but I think they could dig deeper as far as disaggregating data to make that readily available. We talked about that a little earlier, and dialing it down to the community or county level to make sure which counties need support, and then having those elected officials hear from the folks on this call and other groups as well to say, we need to invest in that area through action. I think Senator Hayden and Senator Champion have done a good job, as well as the people of color posse, and doing a good job of making the information known to communities. But they're going to need our help once the dollars are being fought for as well. I think another thing you could do with the politicians is look at agencies that are going to be impacting our community. So for example, Habitat for Humanity is fighting for housing for our community and advocating for making that housing need addressed even after folks are being possibly displaced due to rent or mortgage issues and those kind of things. Supporting organizations like that who have a voice. And the other thing is you can't physically go to the Capitol anymore, I don't think, but just making sure you reach out to your legislature or senator. Senators Klobuchar and Senator Smith on the federal level definitely want to have a positive impact on how Minnesota comes out of this. So I'd say reaching out to them directly as well. So those are just a few things, Harry.
Yeah. And going back to the point that was said earlier, and I think that this will ring true once we get all the data back, is we as Minnesotans were self-quarantining before. It kind of is a state of habit here, and it made it a lot easier, in my opinion, for us to continue this mode, whereas in other cities and things of that nature, it would have been a harder transition. So I guess that's the one time where a Minnesota winter came in as a blessing.
And Harry, could I add one thing just in terms of a population that is has difficulty with this is folks who don't have housing. I think someone mentioned housing earlier, and that's a group who have a hard time, you know, quarantining, getting from spot to spot. A lot of the you know, facilities that they normally go to use the bathroom or to shower are closed. And that's quite a vulnerable group that I thought I should mention.
No, absolutely, absolutely. And they do, in the state dashboard, they are trying to aggregate out for the homeless population to see how it affects and spreads there as well. But that's an excellent, excellent point that you bring about. We are coming down to the last couple of minutes. I would ask each of you, starting kind of from the top with Dr. Let's start with Dr. Joseph DiCaprio, just kind of final thoughts.
Well, thanks, Harry. And, you know, thank you for letting me participate. And I loved all of the questions, all the comments from the other panelists, and all of the information in the chat. There's lots of things I need to follow up on. People, some folks sent me some information through private, you know, privately, so the whole group didn't get it. So thank you. And I would suggest that if there's anything that was sent privately to me that you think the group might benefit from, Harry, is it okay if it's posted publicly?
Oh, absolutely. Yes, we want to make sure that all this information is public because that's our job here. We need to inform one another. That's the purpose of these town halls.
And I guess my last thing, this has been the soapbox that I've been on for the past few days, is we don't know where we are in terms of this pandemic. I believe, sadly, because we're not seeing the huge disparities in the state that we're early still, because it's not like, oh, we have disparities with everything else, but we don't have disparities with COVID-19. I've not seen that there's been a lot of work to keep, you know, African Americans or other communities that are normally suffer from disparities from being negatively, you know, worse impacted, you know, more negatively. So I believe we're early, and I think everything, included such as this forum, that we can do to advocate for what we need, for what communities need, as well as to keep ourselves and our families and our communities safe. We need to do that. We're only at the beginning.
Dr. Rahshana Price-Isuk.
Thank you. Thank you for having me to this forum. I hope it was informative for everyone. And we just, please, everyone, keep yourself safe and don't hesitate to reach out to your doctors, nurses, your clinics to advocate for yourself and your needs. And I hope to be able to see you all and meet with you all soon again.
Ruben Moore, we still got you on the call. Okay. Brother James Burroughs.
You can call me doctor too if you want to. I'm not.
And attorney.
Couple things. Keep washing your hands 20 seconds. Make sure you keep physically distancing. Don't social distance. Brothers like Harry and other folks need to hear from you. Call each other, Zoom. Make sure we're socially connected, although we got to be physically distant from each other. As the doctor said, keep getting outside, getting some sunshine, some bright light. But also, too, take into account all the things we said today and realize this is the first of many of these conversations. And let's start doing something together. We have enough disparities here that even if it comes that we didn't have a large disparity as far as Black people infected by COVID, we got a high unemployment rate. We got a high business, probably shutdown rate of Black-owned businesses caused by COVID. We have a large homeless rate of Black people. So we got enough disparities to address, even if this one doesn't hit us as hard. So keep doing that. Let's come together and do some great things. Thanks for having me on this forum.
Thank you. And we also want to thank Dieudonne Asambang, who we had earlier. And most important, we want to thank everyone who tuned in to this broadcast, whether on Zoom or on Facebook Live. This has been a co-presentation of the African American Leadership Forum, along with Insight News, NorthPoint Health and Wellness, and Minnesota Community Care. We're going to have this continuing discussion for as long as we're in the midst of this crisis. We want to make sure that you get true and accurate information from us. And I'm going to repeat, true and accurate information from us. We want to make sure that we provide and are your best source and best resource. If you have any other questions or comments, please reach out to ALF either through their website or Facebook page. And we look forward to talking to you again. I believe we will be at this in 2 weeks from today on Wednesday, May the 6th. So please stay tuned. And again, thank you all. Be well, be safe, and we look forward to seeing you soon in person.